When people think of dentistry, they think of teeth typically, but an also equally important component are the gums and the bone that hold those teeth in. And in the past few years, there has been a lot of development in the theory of what causes gum disease, gingivitis, and overall oral issues. One of the biggest correlations that we've seen is the connection between oral periodontal disease and heart disease. So ironically, by having a lot of issues with the mouth and a lot of bacteria in the mouth, it can lead to more of that bacteria passing into the system and causing potentially heart issues. So there is definitely a correlation between that. The mouth, unfortunately, is one of the dirtiest places we have on the body. And to look at kind of an illustrative purposes here, healthy tissue should look something like this, where we have teeth that are positioned well, the gum is pink, it's healthy, it's happy. As we move to the next category, this is more of a gingivitis type of situation where the gums, you'll notice, compared to the first example, are a little bit more red. Looking at the example here, when we do probings, which many of you have had when you've had your teeth cleaned, it gives us an idea of the health of the bone with the gum covering it. This will then progress to where we have more other issues that may occur, which is the beginning of periodontal disease. And as we extend to the next one, our probing depths get up to 7s and 8s, and this can be definitely well within the disease process as seen in this picture. Bone is inflamed, it starts to actually erode away, and you can't have that bone back. The gum also on top of it will be red, inflamed, as you can see down on this lower picture, plaque and bacteria. It creates just more of a dirty environment, so to speak, and this type of scenario from here and here can lead to often the issues with your heart as a result of the oral environment. As we get more advanced at this stage, we have a loss of tremendous amount of bone, and then we start to see the disease process get more progressed, and as seen in this x-ray, we see massive amounts of bone loss, and eventually the teeth will be lost. The unfortunate element of periodontal disease or bone and gum disease is that you don't feel it. It's not painful. It is really a silent attacker. So many things in our body, if things are not going well or they're in a disease state, we feel it. It's painful. And you go to the doctor and get it fixed. This is something that doesn't have any pain. It doesn't have any pain until the teeth start to get mobile, or you have a sandwich that you bite into and a tooth falls out. That can be a very traumatic type of situation. That happens in more advanced standpoint of more advanced disease process. So gum disease, make sure you do see your dentist on a regular basis and maintain, because we don't want to see this progression of a deteriorative disease that can potentially lead to heart issues and potentially death. It's a very serious situation.